Correct. And you see, this is what we discuss. Anything, any query about allergic fungal sinusitis, I am not describing the CT scan in detail. We'll be looking at the CT scan before every case, and some or other finding I will keep highlighting. So this is the first case, everything ready, right from the maxillary sinus, frontal sinus, maxillary sinus, ethmoids, classical unilateral allergic fungal sinusitis. Any questions?
Sir, like in sinonasal tumors, like what is a CT scan finding? Like if it is.
Yeah.
Hello?
Yeah, so sinonasal tumors are something which you have to be suspicious. Once you look into the nose, you will find in the inflammatory disease multiple polyps. In this patient, like you will see the fungal mucin in between and classical symptoms of allergic fungal sinusitis rules out any tumor. Yes, once you suspect any tumor with something suspicious, not looking polyp, some symptoms not warranting like polyp, then you have to be, ordering further investigation, contrast studies, all that is required in those situations. Routinely, it is not required. Hello. Hello.
Yes, sir.
So, do we go ahead with the surgical part or any
Sure, sir.
questions regarding this?
Sir,
Yes.
is this software available easily? Like we can see all the three planes in one go.
Yeah, this is available at Google.
Okay.
You can download from the Google.
What name, sir?
Huh?
Any
Name is Radiant Dicom Viewer.
Radiant Dicom.
Radiant Dicom Viewer.
Thank you, sir.
You can download, you can use it free for some time, and there is some nominal price for the lifetime. You can subscribe it.
Thank you, sir.
But this is very versatile, or any DICOM file it can open, and this is really good to have dynamic imaging. Okay. Work. So now we are switching to the surgical part. There are endoscopic picture lagana. As we discussed, I hope I am audible.
Yes, sir.
So as we discussed, the pre-operative preparation is very, very important before surgery. And this has to be started few days or weeks before surgery. Are you getting the endoscopic picture?
Yes, sir.
Can you see the allergic mucin?
Yes, sir.
The
Well seen,
classical allergic mucin I was sucking out. See this? Hello?
Yes, sir.
Yes, sir.
Visible, sir.
Yes, sir.
Classical allergic mucin and multiple polyps. See how these patients present. This is classical, one of the endotype, allergic fungal rhinosinusitis. Okay?
Yes, sir.
See the allergic mucin. Now the pre-operative preparation, I told you the aim of the preparation is to optimize surgical field. And see what I'm using here, intraoperative preparation. Until now, no preparation was done, and I'm using saline adrenaline here in the ratio of 1:2 and carrying through the marrow cell. See, two marrow cells cut in different size pieces, soaked in the saline adrenaline solution and applying in the nasal cavity softly, not very hard push. We are not supposed to press into the cavity to give venous congestion. Just apply adrenaline on the mucosal surface. Okay.
Sir, one part of saline and two part of ADR, or
Yeah. So there is nothing hard and fast. In young patient, you can use even pure one.
one is two?
Because this is topical. We never advocate infiltration into the nasal cavity. Any adrenaline, if you infiltrate, happens to go in the systemic circulation, can have, fatal cardiovascular effects. So it should be as much as possible avoided. And what we believe, if you do a proper pre-operative preparation and intraoperative preparation, you ultimately achieve the same quality surgical field, even without the infiltration. So here I am doing topical one. See, the aim of the topical is to apply adrenaline to the mucosal surface everywhere to decongest it. And even the single application of the adrenaline prevents its further absorption. And you really don't need to, use the adrenaline again and, infiltrate the adrenaline again and again. Say this preparation, I am decongesting the mucosa, nothing else, just decongesting. You don't need to keep the pack for long. You just apply for a few seconds, remove it. The beauty of the marrow cell is it is so atraumatic. Rather than gauze pieces, it is so atraumatic to the mucosa. The mucociliary activity remains unaffected. It is not damaged with the material. See this all eosinophilic mucin.
Yes, sir.
See, these are multiple polyps, eosinophilic mucin, and my
Generally, how much
nasal cavity. Yes.
Sir, how much time it takes to decongest? Generally 10, 15 minutes or what?
Yeah, 5 to 10 minutes. You don't actually, you apply for 1 minute, apply for 10 minutes, the effect is going to be same. Our goal is to apply this on the mucosal surface, not anywhere. Now, this is one part, the intraoperative preparation. Other part of the intraoperative preparation is to reduce the cardiac output with the anesthetist's help. And our anesthesiologist here, whom with I'm working, is an integral part of our team, and I have done more than 1 lakh cases with him in our otolaryngology head and neck skull base surgery. He has been part of our, entire team here for so many years, and he gives us amazing field by means of reducing the cardiac output. We never ask for, hypotensive anesthesia or anything which could be detrimental to the patient's cardiac status, particularly in cardiovascular labile patients having coronary obstruction or anything wherein hypotensive tension can precipitate a cardiac event. We never ask for that. And this bleeding particularly, to understand, is basically not from major arteries. This is purely from the capillaries. And here the most important parameter which minimizes the bleeding is the reducing the cardiac output. And that is achieved best by reducing the heart rate. That's it. You don't need to give a hypotensive anesthesia or do anything. See now, polyps have shrunken.
Yes, sir.
Nasal cavity has opened up. We have
Yes, sir,
to
well
be
said.
strict, not going to the opposite side straight. How is the picture there?
It's perfectly fine, sir.
Hello?
It's fine, sir. Perfectly fine, sir.
Hello? I don't